Good morning. Thanks everyone for coming. We've got a standing room only, it looks like. So I'll be talking about treatment for wet macular degeneration today. And 20 years ago, I was thinking about this. 20 years ago, if I was giving this talk, it'd be pretty fast talk, actually. There wasn't much available. And now I get the chance to tell you about not just some great things that have happened in our field over the last 20 years, but things that will be happening, I think, in the near future as well. So we'll be talking about some medications today that also are being used either what we call off-label or also not quite FDA approved yet. So these are also future therapies, okay? So wet macular degeneration. This is the form of macular degeneration that's usually accompanied by really rapid vision change or vision loss. There's a medical name for some of the changes. We call that neovascularization, and that means new blood vessel growth. Neo means new, and vascularization is that growth of blood vessels. So neovascularization, you might even hear about wet macular degeneration being called neovascular macular degeneration, and that's because part of the rapid change is that your body grows these irregular blood vessels, these new blood vessels. Because of these blood vessels, your retina becomes thicker as fluid kind of seeps out and thickens the retina, and that's what leads to that rapid blurred vision. And unfortunately, in some patients, they even get bleeding, and that can cause serious and permanent vision loss. So I have some pictures here. Up on the upper left, you'll see a picture of a retina, and that's some early changes of neovascularization. And here at the bottom, we can see where that may have advanced to hemorrhage. Let's see if we get that. And so early, here's that picture again. In the center, you can see maybe a few little spots of red or blood there, and there's some kind of graying area. That's that neovascularization. I've outlined it here with this red line. And then unfortunately, if that's untreated, that can evolve into this larger red spot. That's hemorrhage under the retina, all in the central area where now the vision is severely impaired. So treatment requires two things. The first is detection of disease. So first, how do we tell if someone has wet macular degeneration? And then secondly, how do we halt that progression? How do we prevent it from going from that early stage to then that more late, more severe problem of bleeding? And maybe can we even reverse some of those changes as well? So one of the main ways that we detect macular degeneration is with an imaging test that we do in the office called OCT, optical coherence tomography. And so this test, if you ever see a retina doctor, even if you don't have macular degeneration, there's a really high likelihood that they'll do this test for you because it allows us to see your retina in a very quick, painless test, and we can see a lot of detail and get a lot of information. So if you look at the pictures up here on the upper left, that's a photograph of someone's retina. That's a patient who's passed away. They donated their eyes to the lab. We got a small slice, and through the microscope, we can see in the pink, that's the retina. It's a quarter of a millimeter, very thin area. And then the upper left, that's the same picture of a retina of a normal person in the clinic through an OCT scan. And that's just an infrared scan that's acquired in a few minutes. If you look at the bottom, that's one of our photographers, Sandy, getting an OCT image on a patient. You just place your head, and it's a quick scan and allows us to see the retina in that kind of detail. Without any pain, no contrast dye at all required, and you can just have that test. And that's one of the ways that we help to detect macular degeneration. So when we look at someone with dry macular degeneration, you might get a scan like this top scan, which is pretty normal looking, that little dip in the center that you might see through the side view of the retina. You can see actually there's a little, unfortunately I don't have, let's see, I have a little pointer here I can get on some of the screens. There's a little white spot here. That's some of that drusen, that pigment deposit that we've been talking about that may indicate some forms of dry macular degeneration. And then someone might come in, they say, I have a little bit of blurred vision, and we get this scan. And now you can see a little bit of a difference. And here there's some fluid. I outlined that in red. The retina looks a lot thicker than the retina above it. And then underneath, you might even notice that there's some areas of that new blood vessel growth, that neovascularization, and that's how we make that diagnosis of wet macular degeneration. So our treatments have been designed to look and see, well, what's happening to the eye? What makes the eye change from the bottom left picture to the bottom right. And it turns out there's a molecule in your eye called vascular endothelial growth factor, VEGF, or VEGF, we commonly call it. And there's a lot more of that as you get from that bottom left to that bottom right. And so what if there was a way to just block that and stop that VEGF from being produced? Maybe that would be a way that you could actually help improve the vision or prevent people from going from that bottom left where maybe their vision is a little bit affected but not too bad to that bottom right where it's severely impacted. And turns out there is something that does that. There's a medicine that we now do and we inject inside the eye that blocks this VEGF molecule. In fact, there's 3 medications now currently on the market, and they all work similarly. They block your body from making this VEGF signal. They last in your eye for about 1 or 2 months, and then they clear from your system. So it means that people need to get commonly chronic or repeated treatment. It also turns out that these medicines work for other eye diseases. So you might hear about people getting eye injections, and they may not have macular degeneration because other diseases also, it turns out, are affected the same way. So we've really been very fortunate that these medications have come out. And so this is just a little table just showing what happened. This is some of the early studies, the first studies that showed, this is the results from the first study that proved that these medications worked. So we talk about the patient's vision. So in the top row, you see this is a patient, let's say, over 2 years who had no treatment for their macular degeneration. And on the eye chart, they saw over 2 years, 15 fewer letters than they did when they started. So there was no treatment, you lost 15 letters. If you just think about that on the eye chart, I put that at the bottom, the chart they were using, 5 letters meant 1 line. So they couldn't get as far down on the chart to those smaller letters. They got 3 lines worse over 2 years if they had no treatment. And then with treatment, at 6 months, people actually gained 6 letters. They got 1 line better. So previously at 6 months, they were getting 1 line worse, 1 line better. And then at 1 year, that was almost 1.5 lines. And over 1.5 years and 2 years, kind of maintained that 1 line gain. So this is really remarkable, and this is around 2006 when these medications first came out. So not that long ago. If you like pictures better, this is the same information but in more of a graph form. So if you had macular degeneration and you weren't getting treated, you'd follow this red line, and over the course of time, your vision would be getting worse. Lower on the graph is worse. But if you got treatment over those 2 years, it would be this blue line. And you can see here how there's just such a big difference. That line in the middle was if you had no change in your vision. So it's really a remarkable story for us. And the universities played a big role in a lot of these developments over time, as well as in terms of our Fundus Photo Reading Center and our clinical trials development as well. And so I'm sure some of our patients have participated in these trials and helped us to learn about the course of these diseases and how we can further treatments. So everyone always wants to know, what's that injection like? You know, everyone, I think, always imagines this big needle coming right at them. You know, so I thought we'd at least demystify that. This is a patient of mine who is getting an injection. So let's see if it plays here. Jessica, could you play that? So when we start out, we just give some eye drops. These help numb up the eye, prevent infection in the eye, and we use something called an eyelid speculum that holds the eye open. The way I usually give the injection, I use a little Q-tip. It just helps numb up the eye a little further, and here's the injection right here. And that was it. It's a very quick procedure. I don't know if you want to watch that again, but that was basically it. And then we actually rinse out the eye, and we'll see we see the patient usually within a few, 1 to 3 months usually. All right. So here's another example of a patient. There's no more videos, so don't worry. Okay. If you look at this patient, this is a patient with macular degeneration. In the right eye, we have a picture of their retina, and then on the bottom right, you see a scan of the right eye. That's dry macular degeneration. But in the left eye, they came in with a little bit of blurred vision. There's a little bit of fluid. That's that dark space right here that's not present in the other picture. This dark space, it's not present here. And that was actually some early wet macular degeneration. So this patient came in. We said, it looks like you have some wet macular degeneration. They noticed that their vision was a little bit blurry, but not too bad, actually. They got just one injection, and even right after that, the vision cleared up, that fluid went away, and they felt better. Now, in the long run, they may still need some additional treatment, but it's pretty remarkable that just with the one treatment, and we can see this result really quickly in the office. Our technology has really reached quite an amazing perspective. I think sometimes we take it for granted almost. This is part of our daily routine. But we see this so quickly that there's been this improvement. It's really, really remarkable. So I'll just say a few other words. There used to be laser treatment for macular degeneration. This was first approved actually prior to these injections, but it turns out the injections do a little bit better. In the case of the laser, you have to get a medicine through your vein. And then in order for that medicine to be activated, you get a laser treatment. It was first available, as I mentioned, in 2000, so about 6 years prior to people getting injection therapy. And it turns out that it's kind of difficult. You get this laser, and then you actually have to stay covered up for about 3 to 5 days afterwards. You can't be exposed to sunlight because of the way the medicine works. That's easy in the winter, but you can imagine in the summertime that gets to be kind of tough. And then, in some cases, we still might use the laser because maybe the injection medicines aren't working as well as we'd like, and so we use this in combination with the laser just to see if we can help get better control for some of our patients. Some people always ask me about surgery. Is there surgery that you could do for macular degeneration? In some cases, there have been surgeries that have been attempted for wet macular degeneration. Often it's in patients who have kind of the most severe forms or stages of the disease where there's really a lot of blood present. And other times, people have tried to transplant retina tissue from other parts of the eye to see if that would help improve vision at all. Unfortunately, none of these are really in routine use, although sometimes you might recommend something if the case seems severe enough. But sometimes if you come in with severe bleeding like this, we might consider doing a type of surgery. It can be kind of tough though. So many patients, injection therapy, even with this kind of bleeding, will try to see if we can just improve or preserve some vision. So future treatments. So a lot of future treatment centers around injection medications. We know that these injections can be given safely. They're fairly, I don't know if they're pain-free, but they're fairly low intensity. And so one medication that's probably coming out in the future is thought to act a little bit longer. It works a similar way, but maybe acts a little bit longer and stays inside the eye a little bit longer. That's from a company called Alcon. Another company called Allergan also has a similar product they think will last a little bit longer inside the eye. That might be in the next year or two that we'll have that available in the clinic. And then other medicines going on in clinical trials work on not just targeting that VEGF, but also other molecules inside the eye that might be involved in kind of creating those new blood vessels. So maybe there's ways to not just stop the VEGF, but other problems that are being created. And finally, a lot of other modalities in this injection process. The idea is maybe we just do this with fewer injections per year. Maybe the medicines can last a little bit longer for you. A second exciting form of treatment is something called a port delivery system. So this is currently also undergoing trials with the Federal Food and Drug Administration. And so this is called a port delivery. And so in this case, you'd have a small surgery where a little port is placed inside the eye. And then instead of getting an injection every time with a needle, you almost get a refill, like stopping by the gas station. And so, this is currently undergoing the more advanced trials to see if this could become approved. But it turns out that in the first or the early studies, it looks like people could go about 6 months before needing a refill. So that's pretty nice. If you're coming in every month, instead of having to come in every month, maybe you could come in twice a year and just get kind of topped up. All right, and then the last thing, you hear a lot about stem cells. Dr. Altweel mentioned stem cells. We have a talk devoted to stem cells. So here's the idea that there's cells in your body or from and maybe somewhere else that could be used to grow or regrow tissue. They could turn into anything and they could regrow retinal tissue. There's many different kinds of stem cells, and there's early trials for some of this in the United Kingdom, United States, and it's really just a developing field. Dr. Gam is going to be talking about that later. All right, so in summary, there's more treatments than ever for wet macular degeneration, but there are still new therapies being developed. There's really a lot of areas where we still could do better. And so, we can hopefully make these drugs last longer, reduce the number of times you need to come in the office, the number of times you need an injection. Or maybe some people don't do as well with the current treatment, so maybe we can find something that does a little bit better. And then finally, the last part is, can we regenerate? So some of the damage that's done from this disease can't be reversed right now, and so are there ways that we can find to make that better? So thank you very much for your attention. Thanks for coming this morning.